When we look in the preclinical data, dibenzazepine is a major family of neurotransmitter drugs. Imipramine is a subfamily of dibenzazepine. It was mainly developed for the treatment of depression. It also helps in the decreasing of the delta wave of sleep. Delta wave is nothing but when a person goes into a post-traumatic or a pre-systematic sleep, the delta wave is the main causative of depression or any disease. It was developed by SIBA in 1950. FDA approved imipramine administration orally, that is by capsules or tablets. The per day dosage of imipramine varies from 10 mg to 50 mg depending upon the severity of the depression and other physiological factors. Preclinical studies are mainly done to check out the efficacy profile of the drug. Preclinical studies are also done to get approval of FDA to carry forward the clinical trials in human beings. So imipramine was mainly done to attenuate the neurotransmitters such as depression, anxiety, ADHD and neurosis. It was performed on animal models such as rat, dog, mouse and rabbit. Efficacy and toxicity studies were taken care of. In the efficacy studies, I have listed 3 examples, that is the male mice, the male Vista rats and the female Vista rats. 2 different kinds of treatments have been taken place. One is acute treatment and the other one is chronic treatment. So the imipramine concentration varied from 15 mg per kg to 10 mg per kg and 30 mg per kg in the male mice, female Vista rats and male Vista rats respectively. As we can clearly see, the NO2 and the NO3 levels have been decreased in the male mice. The MDA levels have been decreased while the SOD levels have been increased in the prefrontal cortex and hippocampus in the male Vista rats. Imipramine was given for 1 to 2 weeks in the female Vista rats and they could clearly see a promotion of the stage 3 and stage 4 respiration rates in the female Vista rats. When we look into the toxicity profiles, we could find out there was a lethal dosage of 50% in the rat and dog. In the rat, it was between 355 to 882 mg per kg, while in dog it was from 100 to 215 mg per kg. Out of all the 4 animal studies, only one animal showed fatal signs, that is the mouse. This has happened when the imipramine concentrations were increased more than 30 mg per kg. In the pharmacokinetic data, we can check on the absorption, distribution, metabolism and excretion. As we all know, imipramine is a lipophilic drug. The rate of absorption is very low, that is 2 to 8 hours. The extraction ratio is 0.3 to 0.75. It follows a non-linear pharmacokinetics. The distribution has a partition coefficient of 1000 to 10,000. There is a large volume of this distribution, that is from 3 to 63 liters per kg. Lung, kidney, brain, liver and the skeletal muscle has more distribution when compared to the plasma and adipose tissue. When we see the metabolism and excretion, imipramine is mainly cleared by hepatic metabolism. It is also cleared to a concentration of 5% by urine. The major pathways in which imipramine take part are demethylation, hydroxylation, glucuronide conjugation, while the minor pathways that take part are N-oxidation and dealkylation.